Hi, I'm Dr. Tom Deniswitz with Airrosti, and today we're going to talk about carpal tunnel syndrome. Now, all the information that we're about to go over comes from our live free webinar series, and if you'd like more information about that, click the link below. But without further ado, let's get started. Here are some interesting facts about carpal tunnel syndrome. Carpal tunnel syndrome is irritation or compression of the medial nerve as it enters the wrist and the hand, meaning it's going to affect the thumb and the first three fingers on the palm side of your hand and nothing on the back of your hand. Carpal tunnel syndrome is the most common compression or irritation to a single nerve in the body, making up of 90% of all single nerve compression or irritations. Unfortunately, females are going to be far more affected than males in this condition. Up to 3 times more females become affected by carpal tunnel compared to males. And lastly, according to the research, 5 years after surgery, only 60% of those individuals who have carpal tunnel release report a successful outcome. Let's talk about some of the risk factors for developing carpal tunnel syndrome and what those first-line treatment options are if you do develop this condition. For a risk factor, we're looking at a comorbidity of obesity, meaning overweight. So if you are suffering from obesity, you have a higher risk for developing carpal tunnel syndrome. Also, if you suffer from hypothyroidism, you have an increased chance of developing this condition. The rest of the risk factors actually fall more in line with our female population. Those are going to include being pregnant, going through menopause, or taking an oral contraceptive or birth control. If you have developed carpal tunnel syndrome, what are your treatment options? Your first-line treatment options are going to be bracing your wrist, oftentimes especially at night. You're going to want to go through specialized rehab and mobilization exercises for your wrist. And lastly, you can try anti-inflammatory medications either orally or with an injection. Let's talk about some conditions that often get mistaken for carpal tunnel syndrome. Really, any place that we're going to compress a nerve that innervates throughout the hand has the possibility of getting mistaken for carpal tunnel syndrome. One of the locations we can compress nerves is up in the shoulder. There's muscles and joints in the shoulder that can sometimes compress the nerves, usually due to muscular imbalances, and this is called thoracic outlet syndrome. You will feel some pain in the shoulder locally, but oftentimes one of the main complaints will be numbness and tingling into the hand. Another place that we can see nerve compression occurring is in the neck. Whether you have some arthritic changes or disc irritation or just swelling and inflammation in your neck, if it compresses a certain nerve, you'll develop numbness and tingling in the hand. So this is why it's very important to have these conditions assessed by a professional that can help get you the right treatment options. We hope this information has been helpful. All the information today has come from our live free webinar series, where every month we go over a new condition, give you rehab exercises to try, and finish with a live question and answer feature, where you get to ask your questions to one of our providers. If you're interested in that webinar, please visit airrosti.com/webinars. We'll see you next time.